Florida contact tracing a hot mess?
If we're taking 10 to 14 days to process tests, then contact tracing is almost worthless.
Spoiler alert, the answer is yes. Contact tracers reach out to people who've tested positive for COVID-19, find out who else they may have infected, then warn those people. But the state appears to genuinely not know how many contact tracers it has or where they are. What we do know is there aren't enough. Let's see what's brewing. I'm Jenna Bourne, and I'm an investigative reporter at 10 Tampa Bay. If you're new here, welcome to our caffeine-fueled, homemade deep dive into issues that matter to you. And make sure you subscribe so you don't miss an episode. So the purpose of contact tracing is to limit the spread of infection, and we've seen just how easily coronavirus can spread from person to person.
And I have a mild case of coronavirus, but I have been quarantined to my room, this bedroom, for now 7 days.
But it was too late. Sarah Sohn says at least 3 people she spent time with in the days before her COVID-19 symptoms began also tested positive.
My sister is immune compromised, and I did end up giving it to her, or that's probably where she got it. And so that's also been really scary and not a good feeling, especially since I had been so careful beforehand.
So here's how contact tracing is supposed to work. After a local health department is notified someone has tested positive for COVID-19, a contact tracer tracks down the infected patient. They then request contact information of the people they were around starting at least 2 days before showing symptoms. But not everyone, only people who were within 6 feet for 15 minutes or more at a time.
On this day, you had contact with an individual who has been confirmed positive for COVID-19. We don't say names, we don't use pronouns.
So does Florida have enough contact tracers? Here's what the Department of Health told us when we asked in late May, a time when the department said it had 1,522 contact tracers.
It is absolutely an adequate number right now. We're making sure that we have the appropriate amount of staff in every county, and we assess that on a daily basis.
Except the state doesn't seem to be able to accurately identify how many contact tracers it has in each county. I put in this public records request for a county-by-county breakdown of contact tracers, and they responded with this spreadsheet. You can see it's labeled EpiStaff for COVID-19 response. When I pointed out that I asked for contact tracers, not epidemiologists, the Department of Health spokesperson said, that's this column on the end here. But here's the problem with that. The total number, 1,757, doesn't match what that same spokesperson told me just days before. In this email, he said more than 2,000 individuals, including students, epidemiologists, and other staff from across the department, are currently involved in contact tracing every positive case of COVID-19 in Florida. The Florida Department of Health also engaged with Maximus, a widely recognized company with previous experience in supporting governmental agencies, to hire an additional 400 contact tracers. That statewide number isn't the only discrepancy. The state says Hillsborough County has 55, but the Hillsborough Department of Health says they actually have 115 contact tracers. And while the state spreadsheet says Manatee County has 24, the Manatee County Health Department tells me it has 16 contact tracers. Okay. Long story short, the Florida Department of Health hasn't been able to explain these discrepancies, which makes it impossible to identify exactly how many contact tracers there are and what counties they're in. What we do know is there aren't enough. The National Association of County and City Health Officials recommends 30 contact tracers per 100,000 people during the COVID-19 crisis. That means Florida, with its population of about 21.5 million, would need 6,443 contact tracers. That's almost 3 times more than the number the state claims it has, but again, hasn't been able to provide any documentation proving that it actually has that number. Which brings us back to our question. Is Florida contact tracing a hot mess? Yeah, and here's another reason why. Florida may have spent too little too late on contact tracing. Governor Ron DeSantis said this on July 7th.
I've already green-lighted $138 million for the Department of Health to support not just contact tracing, but other personnel.
Keep in mind, he said this on the same day the state was reporting a record number of COVID-19 deaths. But even that new injection of funding clearly wasn't enough, because here in Tampa Bay, both Hillsborough and Pinellas Departments of Health asked their county governments for more funding for contact tracing. Pinellas County tells me it's going to spend about $43 million of its CARES Act funding from the the feds on contact tracing and other public health measures. And Hillsborough County issued an emergency purchase order of $750,000 in CARES Act funding. But don't just look at what the numbers tell us about contact tracers trying to keep up with Florida's rising cases. Listen to these experts from the University of South Florida College of Public Health.
I was part of the first wave of people who deployed to Miami.
Is it possible for contact tracers to keep up with all these cases in Florida?
We're seeing a lot of cases. It's very difficult.
Places like Tampa Bay region, where it's spiking pretty significantly right now, it's going to be really hard for contact tracers to keep up, certainly with the current numbers. And even if you augment it, we're really behind the eight ball, quite frankly.
Even if we had the recommended number of contact tracers, many Floridians are waiting 1 to 2 weeks to get their COVID test results.
The delay is maddening and potentially harmful.
Has the ship sailed for Florida on contact tracing?
It's very difficult to effectively conduct contact tracing if you don't have rapid turnaround, because in the amount of time it takes to get that test result, those people have already interacted with so many other people in the public that it makes it extremely difficult to control the infection.
Especially if it also takes days for a contact tracer to reach out.
I would say it was 5 days after I was initially diagnosed, the contact tracer called me to ask me about where I had been and what I had been doing. And then the following day, they actually called me again. I think that they maybe thought that they hadn't called me or I was still on some list.
While Sarah says she was called twice, we've also heard from Florida COVID patients like ER nurse Danielle Weaver, who say they never heard from a contact tracer.
Up until the point where I tested positive, I had been working and, in a pretty high risk job. They didn't ask me about any of the coworkers I had been working with or any of the patients I had taken care of.
I put in a public records request for the number of Florida COVID patients who've actually been contacted by a contact tracer, but I haven't heard back yet. On top of all that, the COVID patients that contact tracers do reach don't always cooperate.
Some people wouldn't give us any information at all because they didn't think that we needed to know it, and they didn't think that we would keep their information confidential. Some people found our questions intrusive. Some people would answer the questions about themselves, but refuse to give us any information about their contacts.
So is Florida contact tracing a hot mess? The answer is yes. We can't rely on contact tracing to stop the spread of COVID-19. It has to be part of a bigger effort where, at a minimum, people are wearing masks and socially distancing, and where we're able to get COVID test results more quickly. If there's a topic you think What's Brewing should look into, send us a tip at turnto10@WTSP.com. Subscribe to this channel so you don't miss an episode, and I'll see you next time.
Mocha, would you care for your espresso here in the guest bedroom or in the lounge?